Hi, welcome to NurseEdScholar. Let me ask you a question, and I want you to answer honestly. How many times have you memorized lab values only to get to the exam and you get the fluid and electrolytes question wrong anyway? Now, if that's you, this video is going to change how you study and how you answer NCLEX questions because the NCLEX is not testing whether you memorize the numbers, it's testing whether you can recognize dangerous patterns and make safe decisions under pressure. Now, in this series, I'm going to stop treating fluid, electrolytes, and ABGs as numbers. Okay. Instead, you're going to learn how the NCLEX actually uses them, as clues. And you're like, what do you mean by clues? Okay. So clues that tell you, number one, who's stable, who's compensating, and who is about to crash. Now, students struggle with lab questions. Most students approach labs like it's high or it's low or it's inside the normal range. Can I memorize it? But you don't understand that, now the NCLEX actually gives you the ranges. And it doesn't matter if you'll be able to see it's outside of the range. But because it's outside of the range, do you know what to do with the number? And that is what the NCLEX is trying to test you. So know that, the NCLEX, like I said, they're asking you something different. And it's asking, what does this mean for the patient? Is this a safety issue? What should you do as the nurse next? This is why students often say, well, I knew the values, but I still got it wrong. But it's more than just knowing the values. You have to understand what the values mean. And that is what the NCLEX is testing you on. Because I think sometimes students they have the wrong type of thinking. And I'm hoping that with this series, I'll be able to help you be able to think or look at, how you use these lab values a little bit differently. And that'll help you be successful on your exams. So when the NCLEX gives you labs, it expects you to do three things. Number one, identify a pattern. Are there, the multiple labs moving in the same direction? Are the vital signs in the labs telling you the same story? Number two, you have to decide if the patient is stable, compensating, or deteriorating. And number three, choose the safest next step. This is why memorizing normal doesn't really help you when the patient is starting to deteriorate. It doesn't help you at all. So let's look at something. Let's look at fluids. Okay. Let's look at, well, it's not really, it's not just dehydrated versus, overloaded. When the NCLEX looks at it, it's asking you, well, it's not asking you really what is hypovolemia. What it is asking you is, what does hypovolemia look like when it's dangerous? So when a patient has hypovolemia, they are going to exhibit tachycardia, concentrated labs. So look at that H&H. They're going to have low blood pressure and they're going to have a decreased urine output. But a patient who is fluid overloaded may show crackles, edema, shortness of breath, and a rising blood pressure. So the decision isn't just about giving fluids. The decision is, will fluids help my patient right now? Or will it make it worse? Will fluids make my patient's condition worse? And that's what you're trying to figure out. Now, when you're looking at electrolytes, and we're going to talk about this in the series, electrolytes are tested by organ system risk, not not math. What they're wondering and what the NCLEX wants to know is, do you know if the electrolyte in what organ it affects? So sodium affects the brain, potassium affects the heart, calcium and magnesium affect the muscles and rhythm. So when potassium is abnormal, the question becomes, is this affecting the heart right now? When sodium is abnormal, the question becomes, is sodium affecting the brain right now? So this is pattern recognition. It's not memorization. And that's what I want you to see. That's why in clinical, they're asking you to look at labs, they're asking you to look at trends, they're asking you to see if there is a pattern. So, ABGs, as you may know, one of the most feared topics in nursing school. Okay. But here's the secret: the NCLEX does not expect you to calculate. Even though in school they expect you to be able to interpret an ABG. But what the NCLEX does expect for you to recognize is it a respiratory versus a metabolic problem, compensation versus failure problem, or do you recognize when breathing is no longer effective? And the real question behind ABGs is, can the patient maintain oxygenation and acid-base balance? And if the answer is no, then that is the priority. Okay, ABCs, airway and breathing, that will be always the initial priority if there is an airway problem, as in, when you have a patient who has abnormal ABGs. And that goes into, you know, the most concerning problem will always be, I guess, the winner. The NCLEX almost always asks which finding is the most concerning. And that really means, it means, you're not looking at what came first. You're not looking at what looks unfamiliar because sometimes on test questions, they'll put something that you've never probably seen before as a distractor. But that's not what they're testing you on. They want you to look at right now in that scenario what threatens life and stability. And that's what they want to see if you understand. Because labs are rarely tested alone. They're typically tested with vital signs, symptoms, and trends. So let's look at something. Imagine this. A patient comes in, they have rising respiratory rate, a decreasing oxygen saturation, and a worsening ABG. So another lab may be slightly abnormal. So let's just say potassium. Let's just say the potassium is 5.8, but the patient is exhibiting these symptoms, the high respiratory rate, the decreasing oxygen saturation, and worsening ABGs. So the potassium is just to distract you because breathing wins. It always will win. And this is how the NCLEX expects you to prioritize. So that is what this series is all about. I'm going to break it down step by step. The second video is going to be on fluid balance patterns, who needs fluids, who do not need fluids. We're going to talk about electrolyte red flags and what really signals danger. We're going to talk about ABGs and hopefully helping you be comfortable with them and not panic. Connecting labs to the medications and to fluids. And then choosing, I always end with choosing the next best step. What's the safest thing to do under pressure? And if fluid, electrolytes, and ABGs make you freeze on exams, you're not alone. And this series is designed to help you recognize patterns and not panic. So please make sure to subscribe to NurseEdScholar. Download fluid electrolytes and the ABG workbook at NurseEdScholar.com. When it's released, it's in the making. And I'm really trying to help you study smarter and test like a pro. So until next time, happy studying for NurseEdScholar.